I want to welcome everybody to today's webinar. My name is Jennifer Hedaya, and I'm the Executive Director at Air Alliance Houston. It is my honor to officially welcome you to our webinar today entitled The Health Impacts of Air Pollution, How Providers Can Address the Harms, co-hosted with our friends at the Health Equity Collective. Air Alliance Houston has been working for decades to address the public health impacts of air pollution in the greater Houston area and to draw attention to how air pollution sources disproportionately expose communities of color and those of lower income, our environmental justice mission. A core component of this work is to contribute to the science base and to our general understanding of air pollution sources and their impact on health. We do this in a variety of ways, including in partnership with researchers and academic institutions to ask powerful questions about how our health could be improved if industrial sources of air pollution were better controlled. Today's webinar marks the release of our newest effort towards this goal and to finding answers to that question. Today, you'll learn new eye-opening modeling data about the impact of the top industrial polluters on excess mortality and asthma, and you will hear from experts about how those in public health and medicine can use this knowledge to improve the lives of their patients. When I first saw these data and the results of this study, I saw how they showed health inequalities, and I immediately knew who I wanted to work with on this webinar, and that is the Health Equity Collective. I have been a member of the Health Equity Collective for many years, and they are championing a new lens on health and impact in the Houston area that looks at the upstream factors of downstream health outcomes. We know that air pollution is one of those upstream factors, and you'll learn more today about how it affects the downstream health inequities occurring in our community. Before we go forward, though, it's also my pleasure and honor to welcome Heidi McPherson, who is the manager or co-manager of the Health Equity Collective, who is also going to share a brief welcome with you today. Thank you, Heidi. Thank you to the Health Equity Collective for being part of this work with us, and I turn the floor over to you.
Thank you, Jen, and thank you for inviting us to be a co-host for this important webinar. We are very excited about the work that y'all are doing. It's so important for our community and for health equity. I am privileged to be co-lead of the Health Equity Collective alongside Dr. Shrila Sharma. We're both within the University of Texas Health Science Center, the Center for Health Equity, and privileged to be co-leading this very large multi-sector coalition effort for our region of how do we connect the many important critical aspects of health equity. And there's so much amazing work that's happening in our region. And we know we're more impactful when we're connected and learning from what each other is doing. And so with that framing, we are very excited to hear more about the work that you and your team have been doing, Jen, and take it back to our respective efforts. So thank you very much for your leadership in this space, and welcome everybody. We look forward to building from what we learn here today.
And now it's my true pleasure to introduce you to and turn our webinar over to Air Alliance Houston's Director of Research and Policy, Dr. Inyang Uwak. She has been leading our effort to contribute to the science base and build understanding of air pollution's impact on public health. And she will guide us through not only the results of our study that we are releasing today, but also the engagement with our panelists who will share their expertise on how, again, the public health and medicine communities can address air pollution in their work. Thank you, Dr. Uwak, for your leadership on this work. I'm excited to hear from you and your team, and I turn it over to you.
Thank you so much, Jen. I appreciate that. And welcome, everyone. Good afternoon, everyone. And thank you for joining us this afternoon. I will share screen quickly, and we can dive right in. Let's see. 1 minute. Right. So I'd like to start with some acknowledgements. I would like to use this opportunity to thank our speakers and co-sponsors. Thank you, Arandi, Dr. Milando, Dr. Pekison, Edwin Paul, Laura Campos, and Anthony D'Souza for doing this. And big thank you to our co-sponsor, Health Equity Collective. A little bit of housekeeping. This webinar is being recorded with Spanish subtitles. The report will be ready and available at the end of the webinar. You can also add your questions to the Q&A tab, and we will answer them at the end. Please indicate if your question is for a particular speaker or for the entire panel. By way of outline, I will start with an introduction. I will introduce each of our speakers and presenters. Then Dr. Milando would share Modeling 101, and then Anthony would also share the report findings. Next up would be a focus on asthma fireside chat panel with Randy giving us a patient perspective and Dr. Peckison sharing a health provider's perspective. And then Edwin Paul and Laura Campos would share about the Asthma Coalition perspective. Finally, we will open the floor to the audience for a Q&A session. And with that, I will introduce our presenters. Dr. Chad Milando is a research scientist in the Department of Environmental Health at Boston University, where he studies the health impacts of climate change and novel exposure estimation methods. He is especially interested in creating and using novel computational tools to examine health impacts and interventions among the most vulnerable populations. Welcome, Dr. Milando. Anthony D'Souza is the Research and Policy Coordinator at Airlines Houston, where he ensures that the organization's advocacy and education efforts are driven and grounded in reputable data and research to achieve equity and environmental justice in Houston. He has a bachelor's in environmental science from Rice University. He is passionate about communicating research on air pollution and its intersection with health and environmental justice to a variety of audiences. Next up is our panel speakers. Eranda Trevino is a passionate environmentalist, social entrepreneur, and equity and inclusion advocate with a legal background and many years of experience working in public policy. She's a Houston organizer who manages the Healthy Port Communities Coalition, a coalition of community organizations doing important work for the health of communities near the Houston Ship Channel, which is one of the most environmentally vulnerable areas in the country. Next up is Laura Campos. Laura is a seasoned data and spatial analyst with a decade-long position at Rice University, where she's aided in research connecting environmental pollution and its impact on public health. Her interest is in the intersection of data analysis and public health, which led her to specialize in studying the effects of environmental pollution on communities. Next on our panel speakers is Dr. Brett Peckison. Dr. Peckison is an assistant professor on faculty at the UT School of Public Health, where he is the residency program director for the UT Occupational and Environmental Medicine residency. He is board certified in both family medicine and environmental medicine. His current area of research interest includes developing a disaster response e-learning tool for construction workers deployed to communities affected by flooding that provides both health and safety education, as well as logistical and security support. Edwin Paul is next on our list. Edwin is a public health educator at the Asthma Control and Prevention Program at the City of Houston's Health Department. He had a bachelor's in public health from the UT School of Public Health at Austin. He is currently pursuing his master's in public health degree with a focus on health promotion and health education at the University of Texas School of Public Health in Houston. Welcome again, speakers and presenters. The floor is now yours, Dr. Milando. I will stop sharing now. Right.
Great. Thanks, Dr. Rock, and thanks, Jen and everyone at Air Alliance. It's a pleasure to present today, and I'm really grateful to work with Anthony on all of this. So I'll just share a little about what the modeling was that was done here. Okay, hopefully my screen is coming through okay. Okay, so in 5 minutes, we'll talk about briefly the modeling that Anthony and I did. And by I say Anthony and I mean Anthony. When I was very happy to advise on this, I've worked on several health impact assessments in my time as an academic. And it's really great to work so closely with Anthony on something that's relevant to your community. So thank you for including me. And yeah, so what I'm going to talk about is how we calculate health impacts from large point sources. And what I mean by a large point source is an industrial source, this is a cartoon of a stack with a plume of pollution coming out of it. So you'll see this throughout the presentation, along with some emojis demonstrating, health. Something you'll also see is little asterisks for any sort of academic caveats. I think there's a lot of uncertainty that goes into some of these, but I think just for the purpose of simplicity and talking about how we believe these numbers as we'll bin that for later. So the first part of this modeling is understanding that different cities around the world respond differently to pollution. So if you were to take the annual deaths in major cities and stack them all up in a row from low to high, what you would see is if you control for many other things, there's a relationship between low pollution and high pollution and low deaths and high deaths. In this, you could take deaths or any other outcome, you can create relationships like this. And the order of these bars can be, you can represent as a slope of a curve or a line, which essentially says as air pollution increases by some amount, annual deaths or annual outcomes will also increase by some amount. And here's my first asterisk, which means that it's actually quite hard to come up with to make this graph. So there's a lot of math and other modeling that has to go into making this, but assuming you do that correctly, you can come up with this relationship. As air pollution increases by some amount, annual deaths increase by some amount. By the same token, that means that as air pollution decreases by some amount, annual deaths also decrease. So as you can move up this line, you can also move down this line. And that's the essence of the modeling here that Anthony accomplished, which is as we reduce pollution sources from large stacks, so as pollution goes from high to low, we can also calculate the number of avoided health impacts or the amount of health benefit that would occur if you reduce emissions. Again, so how do we decrease outdoor pollution or move down this curve? Is you release less into the air. There's obviously a lot more that goes into it, but again, just for the sake of this presentation, this is the sort of paradigm that we have right now. These stacks, in and around the Houston Ship Channel have some amount of burning that occurs, which releases pollution into the air. That pollution travels from the air to where people live and results in a certain amount of sickness. And so you can see at this level of pollution resulting from this level of emission, you go over to the curve and you go down and you say, okay, this is the annual amount of impact that we have. If we're looking to calculate how much less would happen if you reduce this, so you say, okay, the flame goes from a lot of emissions to much less emissions, less is emitted into the air, less travels through the air to where people live, and you can move down this axis and then calculate the lower impact that it's had in major, in Houston and around. And that's the essence of the work that Anthony did. And I'm, happy to help answer any questions, but Anthony really has done a great job, so I'll turn it over to Anthony.
Thank you, Chad. Let me share my presentation. Can anyone see that? Cool. So yeah, my name is Anthony. I'm the Research and Policy Coordinator for Air Alliance Houston. And today I'll just be going over a lot of the findings that we collected from this project and going over the health impacts of air pollution from Harris County's largest industrial sources. Before I start, I just want to say a quick thank you to Chad for all the support that he provided on this and the insights from his many years of experience. So just a quick background on the area for those who are unfamiliar. So we're looking at Harris County in specific, and this map kind of shows you the distribution of industries across the county. And you can see that there are specific patterns that emerge both in the type of industries and where they're located, as well as the amount of their emissions, which is symbolized by the size of the dots. And something else that's really concerning is that Harris County is home to over 500 facilities in the EPA's toxic release inventory. And they release more pollution than all of those facilities in the top 5 US metropolitan economies combined. So just emphasizing that Harris County is indeed a very, very industrialized county, especially when compared to other large cities and metropolitan areas. And that provided the impetus for our study. We wanted to look at the largest industrial polluters in Harris County, not all of them because of study constraints and the time. So we just decided to focus on some of the largest polluters. And we also decided to focus on 3 specific types of air pollutants. So particulate matter 2.5, NOx, which is nitrogen oxides, sulfur dioxide. I'll cover a bit more about what those types of pollution are and how they're released in the next slide. We decided to look at a specific representative year of air pollution. We chose the year of 2018 to 2019 just because of constraints in the study, but also to select a year that wasn't influenced by COVID. And we decided to look at Harris County in specific. And what we wanted to answer or wanted to examine was how industrial emissions impact asthma rates and excess deaths in the area, which brings us to the how of the study. And for the how, we had to ask a series of questions. And it starts with the most important question, which is how much pollution do these industries release every year? And for that, we had to turn to the emission inventories, which is basically a table of data that the industries submit to the TCEQ that has information on how much pollution they release of specific pollutants. There are certain caveats with emission inventories that I'll cover later, but this is the source that we got this data from. And once we collected all the data on how much pollution the industries release, we had to understand how does this pollution, once it's released, how does it move through and settle in surrounding communities? And to answer that question, we have to turn to air dispersion modeling, which is a tool that people use and it's used widely in statistics to basically understand the dynamics of air pollution. And once it leaves the stack, how does wind and meteorology affect the distribution of the pollutants? And once we understand how the pollution settles in the community and how it affects the concentration of pollution, we can begin to ask the question of what health effects can be mitigated by eliminating this pollution, like Chad alluded to earlier. And we answer that question through health impact calculations that take into account underlying disease rates, the concentration of pollutions, and helps us understand, if we reduce emissions, how many health impacts can we avoid? So like I said before, this is just an overview of the pollutants that we looked at. So number 1 is particulate matter 2.5. It's just a fancy term for tiny particles like dust, dirt, soot, smoke that are in the air. And these are released by burning carbon-based fuels, come from traffic emissions as well, construction sites, unpaved roads, wildfires as well. And particulate matter 2.5 is very dangerous because it contributes to heart and lung disease, asthma, cancer, and mortality because of the way it can penetrate deep into the lungs and enter the bloodstream. The second pollutant we looked at was sulfur dioxide. And it's basically a gaseous air pollutant that's composed of sulfur and oxygen. This is, once again, released when fossil fuels like coal, petroleum oil, or diesel are burned. And something to note is that sulfur dioxide on its own is dangerous, but it also contributes to PM pollution, particulate matter pollution. And it causes asthma, respiratory illnesses, and decreased lung function. The last pollutant we looked at was nitrogen oxides, which is a mixture of gases that are composed of nitrogen and oxygen. So this includes nitrogen oxide, but also nitrogen dioxide. And these are released again, all of these have a lot of the same sources when fossil fuels are burned at high temperatures. And like sulfur dioxide, it's dangerous on its own, but it also contributes to particulate matter pollution. And some of the health effects is that it contributes to inflammation of the respiratory system, asthma, as well as lung disease. Now that we've established the pollutants, once we collected all the data, this is what the distribution of the largest polluters in Harris County look like. For particulate matter, you can see the distribution on this map, but you can also see which areas had the largest emitters, which is symbolized by the size of the circle. This was a distribution of sulfur dioxide polluters in the area. And this was a distribution of nitrogen oxide polluters in the area. And you can see that they all, they're not exactly in the same location, but they have a lot of similar patterns in their general location in the county. They're all kind of concentrated around the Houston Ship Channel area. And then once we collected all of the data on how much of those pollutants that are emitted, which I showed in the previous slide, we have to do some air dispersion modeling. And there are four different sort of data sets that go into air dispersion modeling. The first is basically finding out how much pollution was released, which was shown on the map before. The second two are relating to wind speed and wind direction, which really controls the flow of the pollutants, how far they disperse, and basically the distribution once it exits the stack. And the last factor is surface topography. So what does the underlying area look like? Is it hilly? Is it flat? How much elevation difference is there? And once you have all four of those data sets, you can begin to understand what the pollutant concentrations look like in the community by running it through an air dispersion modeling tool, which is what we did in this new study. And once we did that, we were able to obtain concentrations, what pollutant concentrations look like in the community because of the pollution released from the industrial sources that we looked at. And this is what the distribution of particulate matter concentrations look like. So once the pollution exited the facilities that we looked at, this is the way it distributed among the Harris County and specifically the East Harris County area. And you can see that there are very specific hotspots, particularly as they relate to zip codes. The Baytown area, which is over here, and the Deer Park area seem to be the highest burden areas for particulate matter. With regards to sulfur dioxide, this map shows you the demonstration of how the sulfur dioxide pollutant settled over the community. And once again, you see Deer Park had a high distribution, but also areas on the North Shore. So Jacinto City, Galena Park also had specific, very high concentrations of sulfur dioxide. And with regards to nitrogen oxides, this was a distribution that we found once nitrogen oxide pollution is released by some of the highest emitters in Harris County. Again, Deer Park is highly impacted, but also Channelview and areas north of it as well. And then once we obtain the concentration of pollution in the community, we can turn to health impact calculations. And once again, there are many different data sources that go into health impact calculations, the first of which is the baseline incidence rate. So if we want to figure out the effect of pollution on, say, asthma, you have to collect data on what the existing asthma rates look like in the community at a baseline level. If you want to look at mortality, you have to collect baseline data on what is the mortality rate that already exists within the community. The second factor that goes into this is the concentration response coefficient, which is basically just a value that is obtained through epidemiological studies that describes the relationship between concentration of pollutant and its effect on the health outcome. And it's basically a constant. So if you're looking at particulate matter and its effect on death, that will have a different value as opposed to if you're looking at sulfur dioxide and its effect on asthma. The third factor that goes into health impact calculation is the concentration of the pollutant. So this is what I showed a few slides ago, which is once you've done air dispersion modeling, what does the concentration look like in the community? So the average concentration of pollution observed that is attributable to the pollution released by the industries. And the last factor that is the relevant exposed population. So how many people live within a certain defined area of interest. So this could be a zip code, this could be the county, this could be a census tract or a block group. For our purposes, we focus on the zip code area. And once you have all four of these data sets, you you can begin to calculate what is the estimated number of health impacts that is observed within the community that you can attribute to the model concentration of pollutant. So this includes mortalities, it includes hospitalizations, and any other health outcomes that can be attributed to the risk cause being studied. In our case, we were looking at industrial air pollution. So some of the results, beginning with the quantity of pollution released, nitrogen oxides was the highest with around over 11,500 tons released. Sulfur dioxide was about 5,500 tons. And PM 2.5 was around 2,500 tons. And this is over 1 year, just over from January 2018 to January 2019. And some of the health outcomes that we obtained after running the health impact calculations were that there could be 33 less deaths per year by reducing or eliminating emissions just from these 47 highest industrial emitters in Harris County. And just from 3 specific pollutants that we looked at. And we also observed reduced asthma hospitalizations if you were to reduce emissions of these pollutants from these specific polluters, as well as if you were to sort of run monetary evaluations or try to put a dollar value on the public health benefits of this, it would reach up to about 313 million over that. So these are just some of the public health benefits that we obtained, that we were able to figure out that we could get by reducing some of these emissions. But I think it's really important to put some of these results into broader context as well. So while doing our research, we were able to find a data set that calculates or that models how many deaths, both on a worldwide scale, but also on a national scale or a statewide scale, happen yearly because of particulate matter pollution. So, and the rate I believe in Texas for that is about 15 deaths per 100,000 can be attributed to ambient pollution from particulate matter. So if you were to scale that rate to the population of Texas, you would get about 4,372 deaths every year in Texas that can be attributed to particulate matter pollution. In Harris County, if you scale that same rate, you get 656 deaths. If you were to scale that to the study area that we looked at, which was East Harris County, which was the most impacted part of Harris County just because of where the pollution was concentrated, you get 460 deaths, which is over half of the deaths in Harris County as a whole. And that's where the 33 deaths that we calculated fit into this. And you can see that it actually, just from 47 industrial facilities, the fact that if we reduce emissions from just these facilities and just 3 types of pollution, that you obtain 33 additional mortality rate is pretty significant. And something else that's really important to put into context is the reduced exposure to pollution. So reducing the emissions from these industries will bring about public health benefits in terms of reduced mortality rate, but also it reduces the ambient exposure to pollution in the community. So the annual average of particulate matter 2.5 in Harris County is in recent years, about 10 micrograms per cubic meter. But in the area that we looked at, the cumulative approximate population weighted exposure was about 0.7 micrograms per cubic meter. So reducing the emissions from just these 47 facilities will bring about a 7% reduction in average community exposure, which is pretty significant when you consider just the amount of sources that emit particulate matter. The fact that if you just look at these facilities alone, it brings about a 7% reduction is quite significant. Secondly, if you replicate that same calculation with SO2 concentrations, the annual average SO2 concentration in Harris County is about 0.56 parts per billion. But looking at pollution from these industries in specific, the approximated population weighted exposure can be approximated to about 0.28, which is almost a 50% reduction in average community exposure to SO2 if you were to eliminate SO2 pollution from these 47 specific industries. And lastly, looking at NOx, the annual average concentration in Harris County is 13 but the pollution from these industries exposes the community to about 0.63 parts per billion, which represents about a 4.8 reduction in average community exposure. I want to spend a little bit of time on the limitations just because in addition to being limitations of the study, they also help really put the results that I just presented into a lot of context and I believe, add a lot of significance to the findings as well. Number one is that we, like I said at the beginning, we have to rely on emission inventories, and emission inventories have self-reported data from the industries. And these data, they aren't captured, they aren't real-time measurements that are captured at the stack once the pollution is escaping. They're calculated using engineering estimates, which inherently possess some degree of inaccuracy because it's not real-time measurement. And also the data is not really vetted by any independent authority, any third party, or any government regulator. It's just the nature of industrial reporting in Texas and just something we have to unfortunately take at face value. So that's the limitation number one. Number two is that we only looked at 47 highest emitters of just 3 pollutants. So there are over hundreds of industrial facilities present in Harris County, and a lot of them, including the ones that we looked at, release numerous other pollutants like ammonia, like lead, like benzene, like 1,3-butadiene, and honestly, hundreds of thousands of more pollutants that have their own health effects. But because of the nature of the study, we couldn't look at every single one of these. So that's limitation number two. Number three is that we only looked at point source emissions. So like Dr. Milando was explaining, we only looked at stacks and flares. We couldn't look at non-point source emissions like area sources, like landfills, like mobile sources, like which include traffic, and also biogenic sources. And because of our focus on point source emissions, we also have to include fugitive emissions. And we chose this focus primarily because of the limitations of the study, as well as the simplicity that that comes with modeling point sources. They're much more easier to model as opposed to area sources, which is why we chose to focus on those alone. Limitation number four is that we only looked at a single year of air pollution, which was 2018, which, like I said, it was a snapshot of a representative year that was not COVID influenced. And number five is that the granularity of the health outcomes is limited to the zip code level, which means that there was a lot of averaging that we had to do because we couldn't get health data that was more granular than that. Because of once you look at the block group and the census tract level, you run into privacy issues with regards to health data. And because of those limitations, we had to focus on the zip code level. So these are the limitations. I feel like they really add a lot of context to the results because the fact that these calculations were so conservative and the fact that the likely values are higher means that these results really need to be taken as a baseline. And the likely health effects and likely pollution levels are very high, very much higher than that. So which brings us to our conclusions, which I'll try to wrap up really quickly and succinctly. So number one is that there are a significant number of death and asthma hospitalizations that could be prevented by decreasing current levels of PM 2.5, NOx, and SO2. But not only decreasing them, but just from Harris County's 47 largest emitters, which is a pretty big, a pretty small fraction of just the number of industrial facilities that exist in Harris County as a whole. Conclusion number two is that the communities suffering the greatest burden include Baytown, Deer Park, Channelview, Manchester, Harrisburg, Galena Park, Chino City, Cloverleaf, and North Shore. So all of these are overwhelmingly concentrated in the east side of the county. Number three, which I feel like is one of the most important conclusions, is that the conservative nature of all the parameters and all the modeling that I covered in the previous slide really means that these results should be taken as a baseline. And number four is that further research is definitely needed that takes other facilities into account, takes other pollutants into account, and also that takes other health impacts into account, because I believe once you do that, it really adds a level of comprehensiveness and accounts for further insights into just how the extent to which industrial pollution affects human health. And with that, I believe I'm out of time. So I'll just say thank you to everyone for attending, and I'll pass it back to Dr. Uwa.
Wow, thank you, Anthony. Thank you, Dr. Milando, for that very impactful presentation. Now we will transition to our Focus on Asthma Fire Chat panel. And at this time, I'd like to invite our panelists up, the 4 panelists that we'll be having for this section. All right. Thank you all for joining us this afternoon. I would like to start with you, Erandi. Let's start with your personal story. How has air pollution affected your health and possibly the health of your child?
So I grew up really close to industry, in different cities really, but I always ended up close to industry. First in the metropolitan city of Monterrey, where we have all types of productions, and also a lot of heavy duty freight trucks. So a lot of pollution from that. The second place I lived in was a coal mining town. And then finally, when I moved to the US, I lived in East End, which is right, within a couple of miles of the Houston Ship Channel. So throughout my life, again, I've been having this continual exposure, and it's definitely manifested itself in a lot of health problems. As a child, I had a lot of different chronic problems, including stomach aches, nausea, headaches, a lot of similar pains that I now correlate to environmental triggers, because I have so many different chronic health problems. They're triggered by different things, so they're not always triggered by pollution. I will say that, of course, if I don't eat well, if I don't sleep well, if I'm too stressed, there are a lot of different triggers, but definitely high ozone days affect me a lot. I'm a gardener. I have a small nursery that I actually started because of my health problems, because I reached a point while I was in law school where I thought, I don't know if I can hold a full-time job, because of how many days I only had maybe 1 or 2 good days a week. Still today, now I'm kind of finding coping mechanisms, and I'm on a lot of medication. I take 8 different pills a day for different problems. Some of them I've been told I will have to take for the rest of my life, and some my doctors are hoping that I can kind of taper off. Because again, some medications I take twice a day, another one I take 3 times a day. And so it's one of those things where I'll sum it all to say that it definitely affects my quality of life, because even my alternatives, because I'm always let's have plan A through D at least ready, just in case something falls through. But again, I came up with the irony of all ironies is that I came up with this plan to start this nursery so that I could have some type of income if a job falls through. But if it's a high ozone day, like we had over the summer, a historic number of high ozone days, I can't be outside for longer than a few minutes without getting nauseous or exhausted or short of breath or whatever. Again, the levels vary, and there's different things that are in the air on any given day. So the symptoms also vary. But it becomes a really, really big weight on my quality of life, because I'm dealing with some type of pain on every single day. Not all the different pains every day, but at least some selection from the magic, from the hat of symptoms, which yesterday I actually had a new symptom. So it's one of those things where I'm just collecting new symptoms. It's really, really frustrating. Because where does it end, right? When eventually I want to heal, but living in a place where we're full of so many different triggers, it's really hard, because my body is so often just inflamed. Right. Most days it's inflamed. And I guess the last thing I'll say on that is it again, I almost feel like it's stealing from me, right? It steals like my ability to be productive, my ability to do my job, to enjoy days off. But ultimately, when it comes to doctors, because I know that that's kind of like the theme here, right? Is like medical doctors. How does your role fit in? I'll finish with this recent story. I know I said I was going to finish before, but I'll finish with this recent story of the last time I went to a doctor, which was about a month ago. I went to a new rheumatologist, and her bedside manner, let's just say, was lacking. And one of the things that really stood out to me was that I was trying to give her an idea of like, okay, I have all these conditions, but I also have these triggers that I want you to I'm trying to paint a picture so that the doctor understands the root cause of my problems and what's triggering my health. And so I told her that I lived next to industry and close to industry because I live next to an 18-wheeler parking lot, and it affects me, it affects my family. And she said, well, if you live next to industry, or near industry, and it's affecting your health, it's up to you to change that. And I mean, some people could argue, hey, whether she had a point or not, it doesn't really matter, because ultimately it's very disrespectful. So by saying that's definitely not something a doctor should do when someone is trying to explain to them right, like the situation around their health problem.
Wow. Thank you so much, Randy, for sharing. I really appreciate that. And yes, moving on, I would like to invite Dr. Peckison to give us some health provider perspective. And our first question is, share a little bit about your background and what you've been working on, the patient populations you serve, and yes.
Yeah, so all of my career has been here in the Houston area. I did residencies in family medicine, and then did a residency in occupational and environmental medicine. And so I've always done both primary care, and I've always also seen patients with illnesses and injuries related to occupational or environmental exposures. And I've also been involved in research for many years, and it includes studies of adults with asthma, severe asthma, and looking at triggers and possibly trying to mitigate those triggers by having a team go in and look at home environmental triggers. And so I think that experience more than any, but throughout my career has kind of helped me be attuned to what are presenting symptoms of patients that are affected by the ambient air pollution.
Right. Thank you, Dr. Peckison. And the next question would be to Edwin Paul. Let's start by you giving us some introduction to what the Asthma Control and Prevention Program is.
Yeah. So my name is Edwin. I work with the Asthma Prevention Control Program at the Houston Health Department under the Bureau of Community and Children's Environmental Health. And the goal of our program is to reduce the burden of asthma within the city of Houston. We work with supporting asthma-friendly policies and work with community partners to build resources to prevent and control asthma. So some of our activities includes community outreach, where we work with local partners and nonprofit to target areas with high burden of asthma and provide resources to these communities. We also provide asthma self-management education to children as part of our environmental mobile unit, also known as our EMU program. And our main focus is educating the community and individuals in the community, because we want to discuss asthma trigger management and prevention strategies. And some resources that we offer to community members includes healthy homes assessment, referrals to FQHC community clinics, to ensure that Houstonians really have everything they need to build awareness on managing asthma and the chronic diseases. And furthermore, we go into collecting data, syndromic surveillance through syndromic surveillance directly from hospitals and ER on asthma-related visits to monitor where the burden of asthma lies within the Houston region. The Houston Asthma Coalition is a dynamic network comprising of internal and external stakeholders who work collaboratively to raise awareness of asthma-related issues. We have partnerships with different organizations and agencies, so the coalition is dedicated to collectively addressing and alleviating the burdens associated with asthma. While asthma may be a chronic disease, it does not define our lives. The Houston Health Department's Asthma Prevention and Control Program is dedicated to arming people with the knowledge and resources, transforming the way they manage asthma, and profoundly enhancing community well-being.
Thank you, Edwin. Appreciate that. Now we'll move back to you, Arandi. What would you want your doctor to know about your experience living with a chronic condition and your exposure to air pollution?
Yeah, I would like them to, again, understand how much of an impact it has on a person's day-to-day life, and how much time it takes. Like sometimes it takes hours and hours and hours out of the week just to make the appointments, to talk to the insurance, to then go to the appointments, to fill the prescriptions. There are a lot of tasks involved. So just knowing how burdensome the American healthcare system is, and I'm sure doctors already know, but how burdensome it can be on patients, especially, sometimes if you can't get your medication on time, the withdrawals are really bad. So just understanding again that there are so many different layers to it, because sometimes it seems like it's a process of just turning it out or checking the boxes, right? Like what are your symptoms? Oh, this medication can kind of tackle those symptoms. Here you go. Versus let's create a plan for you to eventually not be so dependent on all this medication. And then also I would like the doctors to understand that the amount of people in this city and in the country that are being affected by this. It's not just the cancer, patients or people who get cancer or who get asthma. There are autoimmune diseases that get triggered by this. There are other things like other inflammation problems, such as arthritis, that get inflamed by issues of pollution. And rarely do we hear doctors talk about pollution. And so that's the thing. A third of the country, about 36%, live with air that is unfit for humans, that really we shouldn't be breathing. And likely water that we shouldn't be drinking. And then that's not even to talk about the food, right? So we're our body's being bombarded by all these different threats. And so it's important for the doctors to sort of come with an understanding and at least if they're not initiating the conversation on pollution, don't dismiss the conversation of pollution, because it is a big factor in what's causing our diseases.
Might just add, Dr. Uek, if I could add, I think Ms. Trevino's experience is really, really compelling, in that, the way our medical system is we have short appointments, and we're really designed to the medical system is to treat a specific symptom with a specific medication. And that's very helpful, but it doesn't take into account the public health issues. And I think that's why approaches like this are really part of a community's approach to improve the health. And I've had patients like Ms. Trevino's that are very much affected by the air pollution levels outside. It confines them to home, and my professional experiences really concur with her personal one. So really, really well said. And I think this forum like this is an opportunity for us to do a lot more.
Right. Yes, absolutely, Dr. Peckison, you hit the nail on the head. And that brings me to your next question, which is how have you addressed the impact of air pollution and chronic conditions in your patients that you see?
Yeah, I mean, there are guidelines that we follow. So for instance, probably most people have heard of ozone action days. And those are days when ozone, which is closely related to nitrogen oxides, that and goes up, and it does go up with temperatures. And so on ozone action days is days that people need to stay home or stay inside. And of course, that's easier said than done if you have an outside job that you're working outside. And for the vast majority of us, when we go outside, air pollutants like ozone, nitric oxide, sulfur dioxide, they irritate the airways. But most of us are able to compensate if we don't have asthma. But for those people that do have underlying air inflammation, that increase in these air pollutants, it causes increased mucus production, it causes constriction of the airways, and they do have symptoms. And so there are medications that one needs to have, rescue inhalers that can help open up the airways that we have patients instruct patients to have. And we also ask them to keep diaries about what days that their asthma is worse, days that it's better. And so that helps influence the long-term medicines, because there are daily medications for maintenance medications to help control it. But yes, and being aware of air pollutant sources, trying to avoid those. But again, that's difficult to say when you live in neighborhoods and you can't very well get away from it. But some of those education about these sources of emissions and trying to schedule your life around it to avoid them as much as you can, to be inside when they're at their peak, are very helpful.
Yes, thank you, Dr. Peckison. So I think my next question would be for Laura Campus.
Hi.
So yes, so as part of the the Asthma Control and Prevention Program, can you discuss how air pollution is a trigger or how air pollution exacerbates asthma?
Sure. So air pollution such as PM2.5, ozone, and NO2 has been strongly linked to worsening asthma symptoms and increased asthma attacks by irritating the airways and leading to inflammation. Asthma is a serious, sometimes fatal condition in which asthma attacks vary in severity, potentially requiring EMS, medical services, or ambulance treatment. A research was done in 2018 by Lauren Hopkins at Rice University, which identified high-risk days for asthma attacks in Houston associated with elevated concentrations of air pollutants. This study led to the current Asthma Air Aware alerts, which are used by the Houston Health Department. We actually had an alert sent out yesterday, December 6th, which is funny because Arandi said she had a new symptom yesterday, and we had an alert yesterday. And this study did find that an increased risk of asthma attacks happened on days when we had both ozone and NO2 that were in high concentrations. The main takeaway from the study was that asthma exacerbations were associated with pollution lags with 3 days for ozone and a mixture of pollutants, not just an exposure from one pollutant. So we must consider cumulative exposure and a mixture of pollutant exposure. The Houston Health Department is working with Rice University and has created an asthma monitoring dashboard, which shows rates of asthma emergency department visits by quarter, along with TCQ air monitor sites, concrete batch plants, which, by the way, does release PM2.5, which Anthony mentioned earlier in his presentation is associated with increased risk of asthma attacks, heart attacks, and stroke. That dashboard also shows metal recyclers, toxic release sites, which Anthony also mentioned earlier, that we have a lot in Houston. And this dashboard also shows community clinics, hospitals, among other things. The viewers will be able to view near up-to-date asthma emergency department rates by zip code. And It's a useful tool because you'll be able to see potential pollution sources overlapping with high rate regions of asthma emergency department visits. When we work with a group of people, things are never a simple one problem, one cause connection. For example, we know there's a high rate region of asthma attacks in Houston, which does have a pollution issue as well. But we also know that there's a routine use medication for asthma. And so it's a little bit more complicated. There's an intersection of air pollution and access to healthcare, education, and services. The mix of different types of pollution is still ongoing research topic across many areas of human health effects, including asthma. So it is a complicated topic, but air pollution does increase exacerbation of asthma. It is a very bad thing. If we can reduce air pollution, we will reduce asthma attacks.
Thank you, Laura. Appreciate that. Right. So moving on to Arandi. This would be your last question, I promise. What would you want your doctor to tell you about the impact of air pollution on your chronic condition?
I would say that it's probably one of my number one triggers right now, because for years I have been working to adjust my diet and control as much as I can. But sometimes I find it's like building a sandcastle by the beach, and then the wave just comes and washes it out. That's how it feels when there's a leak out, in the air, because it can go from some symptoms to very extreme symptoms, right? Where I have like chills, brown phlegm. Sometimes I have brown phlegm, my mom, my niece, my sister, and those are the types of things that you see from coal miners, right? Like that's the thing that coal miners would have, is like brown phlegm. And so that's something that we experience, again, not on a regular basis, but when there are certain extreme peaks and leaks. And so I would love my doctor to understand like just how much, where it ranks. And again, I think it's important to understand the impact of it, because the medication, the way I see it is when I have a symptom, it's like my body is warning me like something is hitting your body that's not supposed to be there, right? And so it's reacting. It's inflammation is supposed to like protect the body, right? So, but when it happens so often, then it becomes damaging to our organs, to our body, to everything. And so one of my concerns that I would like the doctors to know is that I'm concerned that I'm going to mask all my symptoms to a point where I won't be able to listen to the warning signs that my body is sending to me of how unhealthy things are becoming. And so if we just continue to mask and mask and mask the symptoms, eventually we're allowing our world to be formed in a way that really we're not meant to withstand. And we're only withstanding with that lifeline, with those medications. And without it, I mean, I'm going to go back to the situation of where sometimes I don't have my medication because I didn't realize that it needed to be filled, and because maybe I remembered on a Friday and the clinic had to get approval or whatever the case may be, and now I'm out of medication for a couple of days. And so we become dependent on the treatment. We become dependent on the medication. And so, yes, it is efficient to a certain degree, because I used to be at a point of much higher pain, much higher rates of exhaustion and fatigue. And I didn't have the treatment I have now. And so it was more painful. It was a more difficult experience. But who knows? Because now I'm on so much medication that has all these potential effects on my body, and now it's kind of like, in a way, allowing me to withstand all these things longer than I really should, if that makes sense.
Yes, it does make sense. It does, absolutely. That also leads me into my next question for Dr. Peckison, which is what barriers or what are some of the barriers that providers may face when integrating environmental health into their practice?
I think the main one is sort of the feeling of the limitations. Medicine is very much an individual treatment. So you have certain medicines within your armamentarium, but having the resources to help improve a person's neighborhood, improve their home, those are more limiting. And so I think yes. So I think really it's a movement, if you will, of trying to have more recognition by primary care doctors about some of these effects. We are beginning to get electronic health records that can help improve referral rates, and there are resources for counseling, such as people to remediate people's homes. The Healthy Houston Homes movement has a lot of excellent education about indoor air pollutants and reducing those. And like Ms. Trevino said, asthma is multifactorial. There's many different factors. And so if you can identify even a few of them, you can improve that. And so one of the limitations also is the reimbursement system, is that we're reimbursed for providing a certain amount of care, but preventive care is not reimbursable. There's no model for incorporating it into the clinics, or not enough. And so we need to expand that. Providers that have case managers and nurse practitioners that can provide more counseling services as part of that model, I think that they have more latitude as to how to talk to patients about some of these issues. I also just wanted to mention, we've talked about health effects, the respiratory effects of these air pollutants, but particulate matter, as Anthony said, can also cause cardiovascular effects. And what's happening with that is these carbon particles are so small that they go through the airways, they go into the air sacs or the alveoli, and they pass into the bloodstream. And there they also cause inflammation, this time of the arterial walls. And so there have been many, many studies that linked, when you have an increase in particulate matter concentration in the air, you have an increased incidence rate of heart attacks and strokes, even sort of acutely. And so some of those issues are sort of going under the radar. If we were to look at emergency room visits for heart attacks and strokes, that's related to that. And so and most providers, that goes under the radar. We treat people who are at risk for cardiovascular disease, but oftentimes providers aren't aware of what the particulate matter concentrations are in an area, or are the averages over time. And so that is unrecognized. And so again, studies like this that can identify even local sources for that might be higher can be incorporated into that counseling that providers give patients.
Thank you, Dr. Peckison. Appreciate that. Next question will be for Edwin Paul. Speaking of resources and tools, what's an example of a tool or resource that you have available to providers wanting to work in the space?
So we use the CDC recommended National Asthma Education Prevention Program, also known as the NAEPP guidelines for an evidence-based asthma management. So we meet with physicians and providers to discuss these guidelines for asthma management treatment. So this is a standardized stepwise approach for asthma management, with an emphasis that there needs to be different approaches based on different age groups according to these guidelines. So one specific example according to these guidelines would be the Asthma Action Plan, which is a written document that helps individuals with asthma and their healthcare providers to collaborate to work on a personalized management plan. This includes information such as daily medications, instructions for managing worsening symptoms, and guidance on when to seek emergency care. So this is a way providers can give more standardized approach across the Houston region to individuals affected by asthma.
And this resource is available to all physicians, at least practicing in the Houston area, you said?
Yes,
Okay.
definitely, yeah. we use their asthma action plans. We have each agency has their own version, but there's also a centralized version by the American Lung Association that's also recommended.
All right, thank you, Edwin. I have one last question, and that would be for everyone on the panel. And this is, what is one practical change that you think providers could start today to begin integrating air pollution issues into patient care? And this is open to all members of the panel. So anyone wants to take that on first? I can repeat the question. It's what is one practical change that you think providers could start today to begin integrating air pollution issues into patient care?
I guess I'll go first, since I'm the provider. And I think, I think the low hanging fruit, and that is as Edwin said, there is a lot of known literature on asthma action plans, and to incorporate that and ozone prevention days into your counseling, and to really talk to your patients about what that is, what's causing it, and to record that into the electronic health records, incorporate these effects of air pollution on their symptoms into the treatment of the asthma, and that will help not only the patient get better treatment, but also help the provider get a better understanding of the true impact of air pollution on respiratory disease.
I think another simple advice is to have some patience and have some understanding with the frustration of the patients. Answering it's your problem to solve or to move to avoid pollution is not a correct answer, because everyone deserves the right to breathe clean air, as the logo for Air Alliance Houston. So it shouldn't matter that you live near industry, you also have the right to breathe clean air. So just having some grace and having some patience with your patient, and having understanding that they're frustrated because they're doing their part as a patient, eating right and exercising, but it's something that is outside of their control. And just saying, I understand where you're coming from, and let's see what we can do. Something like that. Not you need to move or you need to figure it out on your own.
I would just add that I like to always say, own your power. It's my little encouragement slogan. And for doctors, I think that would mean engaging more in the conversation, doing more research about the impact on, I mean, there's no one better than a medical doctor to really understand, right, the data, the research, and to be able to translate that into patient speak. How do you tell a patient this information? And also engaging, like Dr. Perkinson is doing in these types of conversations, engaging in it publicly so that we can see, I mean, people, it's a known fact that people respect doctors. They respect their opinion and their diagnoses. And so it's important to own that role, and to really say, okay, let's engage and let's talk about it, so there's more awareness.
Yeah, I think everyone gave pretty great responses. My advice to providers would be that, I think educating people on trigger management, air pollution as a trigger, and, how individuals can prevent this trigger. So I would say like a preventive medicine approach. So instead of waiting to treat people who already have asthma, like we'll try to prevent asthma from happening due to air pollution in the first place. So I would recommend education on trigger management.
Well, thank you so much for this deep and insightful discussion. I appreciate it, each and every one of you. And at this point, I would like to give the floor to Rika, who is our communications director, to lead the audience Q&A. Thank you so much, panelists, for sharing. The floor is yours, Rika.
Yes, hi everyone. So yeah, we've received a couple of really great questions. let me just pull those up. So the first one, I think this is a question for everyone. And it's related to the disproportionate exposure to air pollution near the facilities. The question is, I wonder if residencies near industry are more affordable on purpose. Is there someone who would like to answer this one?
I guess I'll go first, and I'm sure we've had all experiences. Yes, that's definitely a factor. Real estate prices take into account their proximity near industry, and so people that it tends to be more affordable, and as a result has got more hazards associated with it.
Thank you, Brett. Anyone else would like to chime in and answer that question? If not, then I have actually another one for you, Dr. Perkinson. It is when I hold on one second. When I go to a doctor for the first time, they will usually ask me where I work. Are they asking that to get an idea of my exposure to toxins, or are they just being nice?
No, they're asking for the occupational exposures. Hopefully they're being nice as well. But so I'd mentioned at the beginning, my specialties is occupational environmental medicine in addition to family medicine, and that's a pretty small specialty. But in primary care, we oftentimes miss occupational exposures and their exacerbations for common presenting problems. So an easy example would be just tendon inflammation, tendinitis, if somebody's typing on their keyboard all the time, or if they're looking at their monitor in an awkward way, causing neck pain. So it can be anything under the sun, including occupational exposures. Another example would be someone that works spray painting cars. The paint is what we call an asthmagen. It can exacerbate asthma. So if I'm having a person presenting with asthma and I know what they do for a living, then I can start going into details on questions about that and making sure that they're getting properly protected when they're at work. So occupation very much plays into our roles. It's something that we don't recognize in the US enough, and it's something that people like me are working to try to integrate more into primary care.
Thank you so much for your answer. I also have a question, quick question for Laura, and maybe you can just drop it in the chat. It's been asked if you could link to the dashboard that you referenced. Would you be able to do that?
The dashboard is currently in draft mode, so I will say with that caveat, and so the link that I share now will be changed because it's going through a lot of changes, but I will provide a link in the chat. Just the caveat is draft, and so you'll see it in red letters at the top, draft, City of Houston Asthma Monitoring Dashboard.
Once it's fully available, is that going to be available on your website?
Yes, and there should be an official announcement by the City of Houston. So I do ask that maybe just keep it with just the attendees and not share it too much.
That sounds good. Thank you, Laura. We do have a little bit more time, so I have one more question. Again, I think anyone could answer this one. So the question goes, what is the solution to the volume of air pollutants? Is it simply to close plants or reduce industry output? I ask because, practically speaking, I'm sure industry would be very resistant to these kinds of interventions, and it may be impossible to implement without policy change. What is the realistic likelihood of passing these policy changes?
So I can start a little bit there. I think industry will always fight and be against it, of course, because they're not going to want to make change. But eventually they will. For example, adding scrubbers on coal plants to stop acid rain. That was fought, but then eventually it was done. So solutions can be mitigation. Other solutions can be adding safeguards to prevent leaks or unplanned emissions. There is the TCQ has the STEERS reporting system where they report unplanned emissions events. And they happen quite frequently, maybe 2-3 times a week, where there's all these emissions of pollutants where it was not planned. So that seems like low-hanging fruit, where we can prevent those unplanned emissions. That's not really changing much in their day-to-day. It's just maybe adding more safeguards, maybe hiring somebody to make sure those leaks and those exposures aren't happening. Maybe hiring more safety officers to prevent whatever happened at TCP fire, or other major disasters like that. It's just a few examples that the industry can do now that is not too extreme, such as closing down or shutting all of industry down. I think there is a balance. There's something that they can be doing now.
I might, just add a little bit to that, is that, my specialty is occupational and environmental medicine, and sometimes those can be two opposing forces, right? So you're helping employees that are getting exposures as well as the surrounding community. And I think we have to go in, with the attitude that all of us, on this conference call are in some way we're supported by these industries. That really it's what the driver is for the Houston economy. And so when you use the words like shutting down, a plant altogether, you're also talking about the people that work in these communities. That's their job. A lot of times they work in these same industries that are causing the pollution to begin with. And so you have to go in with that realization, is that if you're unemployed, you're not in good shape either. And so you can be specific, but that's what's nice about this study, is that you've identified, for instance, where sulfur dioxide is. So for those people that have been in oil and gas, that oil has got sulfur in it. It's got and that manifests itself when you burn it as sulfur dioxide. And as Laura mentioned, there are engineering ways of taking that out. We did the country dramatically lowered sulfur emissions in the diesel exhaust of school buses through a regulation. They just did it. And it's quite possible to do that. And so if you go in specifically like that, you can improve air pollution over time. You can reduce all of these things without shutting down the industry, keeping the industry going. That's what you want. You want a sustainable community. And so a lot of companies will stick to regulations, and by and large, most big companies really stick to regulations. And so the regulations need to be changed. And how they change is by voters and by knowledge and education. And so forums like this, where you're educating people and realizing the importance of passing regulation, supporting Congress people to do that, that's how these things change. And they change in a rational sort of way that doesn't injure the jobs and the economy of the people that they're improving the air environment for.
Dr. Parkinson, I think that's such an important point. And also kind of a reminder that we're all a part of this system. That power is what's keeping us warm right now for most of us. And we have choices in that space and rights and responsibilities as well. We're connected to these issues, all of us.
Thank you so much, everyone, for your answers. We are almost, it's almost 1:30 soon, so we are going to start wrapping up. We did receive, thank you everyone for posing your questions. And I'm aware that we received a few other ones that we were not able to answer, but we'll aim to answer those in writing and share them together with the recording after the webinar. I'll pass it over back to Inyang to close.
Sure. Thank you again, all our panelists and speakers, and thank you to the audience for those great questions. We also want to thank the Health Equity Collective team, for co-sponsoring this awesome webinar with us. At this point, I'll quickly share screen. I have one last slide to share. Give me 1 minute. Let's see. Can you all see my screen? Yes. Oops. Sorry about that. This is, yes. So I just want to share now that the report is available here on this link. We can also add it to the chat if you need more resources, and you can log on to our website at airlineshouston.org, join our newsletter here. We're also social, and we're on all the social media outlets. And in the absence of any other questions or comments, I don't know, Jen, do you have any last words before we close out?
I just want to once again acknowledge our fantastic speakers, our co-sponsor, the Health Equity Collective, and everyone who joined today. These questions were incredibly insightful for us to read. We will do our best to answer them for those we did not get to, and you will receive all of this information after the fact. I know a couple of folks asked in the chat if the slides would be available. Yes, the recording, the reports, all of it will come back out, and we will try to address those questions. I thank all of our speakers, especially those on the Zoom and in the chat who were sharing their own lived experiences with exposure to air pollution. We thank you for educating us. We thank our provider partners for doing their part to keep our community healthy. We thank our Houston Health Department partners for tracking our health. And again, we thank the Health Equity Collective for raising up the importance of everyone in our community having access to good health and the ability to breathe clean air. We thank you for joining us. We look forward to having you join us again at a future webinar. Take care and Happy New Year.
Thank you. Bye.